Now, our next speaker is the president-elect of the American College of Obstetricians and Gynecologists, that we fondly call ACOG. Dr. Mark DeFrancesco has been practicing OB since 1984 in Waterbury, Connecticut. And he's the founder and serves on the board of the directors of Physicians for Women's Health, which includes 200 OBGYNs and approximately 70 offices located throughout Connecticut. Now, he too has a long history. He's a graduate of Yale University, got his medical education at the University of Connecticut. He threw in an MBA in the middle of all that at the University of New Haven. He's published a lot of articles, and he is now an assistant clinical professor of OBGYN at the University of Connecticut Health Center. Prior to becoming a physician, he served as a state representative in the Connecticut's legislature. Dr. DeFrancesco.
Well, thank you very much, Dr. Lawrence, and I appreciate the opportunity to be here. I'm honored to be here representing ACOG. I do have a few disclosures to make. First, I have delivered about 3,000 babies in my career, but did stop about 10 years ago, so I won't profess to still be delivering. I still know how to do it. I'm sure I could help out in a cab somewhere, but the more difficult deliveries, I think I would leave to the younger folks anyhow. But basically, I had a great career, and I loved doing obstetrics in particular, even in the middle of the night. I am breastfed, from what my mother tells me at least. That's another disclosure. And at least some people figure at least, I may have peaked at age 7, but at least I was pretty smart until age 7 at least. So it didn't hurt me, apparently. And my 2 daughters are also breastfed, and the older of those 2 is due in about 2.5 weeks for their first baby right down here in D.C., and she's already making plans to breastfeed. So if my beeper goes off in the middle of this short speech, I may have to duck out of here in a real hurry, but hopefully not. She'll make it through the next couple of weeks, I would think. But I do want to disclose all that at the very least. As you know, and as we've just heard in a great talk from Dr. McInerney, there's tremendous evidence that supports the value of breastfeeding for both women and for infants. And so basically, this is something that really takes care of both constituencies quite very well. College strongly supports breastfeeding. In the next few minutes, I'm going to review the activities and some of the resources provided by ACOG to help fellows, other healthcare professionals, and who are caring for women in particular and their infants, as well as hospitals and employers to support women in their decision to breastfeed. ACOG has a system of committee opinions that they periodically issue. We have various, about 20, 30 committees. Very close to the AAP, we do have about 55,000 members around the country, and in parts of the other parts of the world are starting to join ACOG also. And we have, again, 15 to 20 active committees that produce, written by a series of experts in that particular area, produce guidance for our members that are constantly updated and reviewed. So in particular, I want to review the couple of committee opinions that we do have currently extant that deal with breastfeeding and kind of go over the chief components of those. These are the 2 basic COs that we currently have, and I'm using my cheat sheet here because they are fairly detailed. But Committee Opinion 361 was actually reaffirmed in 2013. It was first issued 2 or 3 years prior to that. But it recommends clearly that the OBGYNs, first of all, it helps to outline the problem that we are falling behind in terms of we're falling short of our target numbers, particularly for continuation of breastfeeding around the country. And that these are important things that we need to attack in the office in particular. So the committee opinions strongly recommends that doctors encourage the decision to breastfeed, not only during routine prenatal visits, but more importantly, even during the interconception period, during the preconception counseling that takes place, and even during postpartum visits, because it's never too late to get people to start sometimes, even if they didn't start immediately. We also encourage our doctors to see what their hospital is doing. A good hospital practice surrounding childbirth can really encourage, as we know, breastfeeding. I know the The baby-friendly movement has been a big help, I think, in Connecticut. I was just hearing from somebody from Connecticut who runs that program, that Connecticut's up to about 25% of our deliveries are in baby-friendly locations, and 25% of our deliveries are baby-friendly. And that's very exciting, considering 2 or 3 years ago, I think we only had 2 hospitals that were baby-friendly in Connecticut. So we've made some very good progress there already. So the other thing, though, we warn our physicians about in the committee opinion is to watch out for those gift packs. When patients leave the hospital discharge, many of them, I understand, still have formula in them, and at least for some patients, that could be an inducement to make it easier, at least, to stop breastfeeding. And so we basically are asking our doctors to have input into those decisions about what their patients get sent home with, and to, again, try to discourage that from happening. After discharge, we tell our doctors' offices they should be pretty much a 24/7 resource for their patients who are having lactation problems. And if they're not able to do that, although everybody's on call 24/7, so we can all take phone calls at least 24/7, we need to, if we don't have expertise within the office, we need to at least know what local resources there are to which we can refer patients for lactation support. And again, this is all covered in the CO. Contraception is very important, as you know. So again, we tell our doctors, when our providers, I should say, because it's more than just the doctors, that when patients come back for their prenatal, for their postpartum visits, and even actually, again, prenatally, discussing contraception afterwards, to certainly recommend good contraception, but to clearly really focus on the details of any contraception that are compatible with breastfeeding. And there are many forms of contraception that can still allow breastfeeding safely and still provide good contraception. So again, we remind people to remind their patients of that. Women need to be supported, as you all know, in integrating breastfeeding into their daily lives in the community and in the workplace. And I would expect that we will see more progress in the workplace area. I know my daughter's very fortunate. She's in a position where she's going to be getting, I think, 4 to 5 months of maternity leave, most of which is with pay. So that's unusual, but she's in a good position and a good place, and everybody should be doing that. Basically, it shouldn't just be, where she happens to work. So I think these are the kinds of things we need to support as we advocate for people going forward. And Ben, ultimately, I think we could catch up with the rest of the world a little bit more also, because ACOG currently recommends exclusive breastfeeding for at least 6 months, but we do stress go longer if possible. And I think if we can push that 6 months to a year would be nice to really try to get that out farther. But at the very least, we're asking our doctors to encourage their patients to breastfeed as long as possible, and to help them as much as we can help them do that at home and back at work if they go back to work earlier. So that's the gist of Committee Opinion 361. 570 is the newer one that just came out in August of 2013. And this one really addresses more the underserved women. And I think, again, Dr. McInerney referred to some of the details there too. But we do know clearly, and the studies have shown tremendous exposure in the underserved women and the poor women to certain adverse health outcomes, many of which they and their children, many of which can be improved with breastfeeding. And we need to kind of promote that. Some of the improvements that really can result from their breastfeeding. The improvements include decreasing the rate of common childhood infections, such as ear infections and diarrhea, thereby resulting in decreased parental absenteeism from work, decreased rates of childhood obesity in children who are breastfed as infants, decreased rates of hypertension and hyperlipidemia, diabetes, cardiovascular disease, a lot of these problems among women who breastfeed their infants, decreased rates of ovarian and breast cancer in people who are breastfed. As we all know, increased bonding between mother and infant, lower risk of postpartum depression, and increased postpartum weight loss. And there may even be a connection between those two things, but you could lose weight faster and you're less likely to be depressed if you are nursing. And certainly decreasing unintended pregnancy. So these are all positive improvements in some of the adverse health outcomes that everybody's subject to, but certainly the underserved women are disproportionately likely to experience. So it's important that we remind our providers of these benefits, but more importantly, it's important that we remind our providers to remind their patients of these benefits to help really drive that message home. What we do know also, because there are so many unique barriers to, especially again for the underserved, that we recognize the need for a multidisciplinary approach to this. It's not just the doctor and the nurse in the office encouraging this. It's a care coordinator that I think more of us will be seeing in our offices going forward. It's the child care providers, obviously, which we're already doing. So it's great to hear about that. And it's basically, we have to kind of engage the social network that the patient's in also, not just the medical, to really encourage the continuation, the initiation of and the continuation of breastfeeding. The other publications, you already saw a picture of the Breastfeeding Handbook for Physicians, which AAP and ACOG jointly produced, from what I understand. It's the second edition, I believe, is the most current, and again, has new information on the benefits of breast milk, especially for preterm infants and for breastfeeding issues during a disaster. In addition to that, there's the guidelines for perinatal care, which are also produced jointly with the AAP. This is the 7th edition. It's out now, and again, that too, this most recent edition provides updated information, particularly on breastfeeding and other areas. In addition to these publications, ACOG also provides information for patients about breastfeeding, most of which are available, if not at their provider's office, actually even on the ACOG website. There's the FAQ, Breastfeeding Your Baby. The ACOG website has access to a lot of FAQs about a lot of topics, but that in particular is on there. And there's the patient education pamphlet or information about you and your baby. And again, and this also includes positive information about breastfeeding. And the ACOG Pregnancy and Childbirth book, the 5th edition, was just out, released about a year or so ago, and actually working already on the next edition. But that also has been very, very popular. It's a very good seller, mostly because it's pretty inexpensive, and we convince most of our doctors to buy it for their office to give to their patients. So it's sold on Amazon too, but I think most of our sales are through our doctors' offices, not selling to the patient, but again, doctors buying a supply to give to their patients. And again, we encourage doctors to do that. We certainly partner with a lot of folks. This is just a partial list, but again, the Academy of Breastfeeding Medicine, the U.S. Breastfeeding Committee, American Academy of Pediatrics, especially the section on breastfeeding, NICHD, and of course the New Thousand Days Initiative project. So we're very proud to be involved with all of these groups, and I'm sure others. So I apologize if you're not on the list here, but I know if we don't work with you, we want to anyway as we go forward. Most recent thing that we've done at ACOG, I think, to address this is to establish just in February the Breastfeeding Expert Workgroup. So it's the BFEWG. That's kind of hard to say, so I'll be looking at my thing a lot. BFEWG. In any event, this is a work group of volunteers, as always. We do everything on the cheap at ACOG and get a lot of volunteers. But it includes not only general OBGYNs, but also maternal fetal medicine specialists and lactation consultants and other advocates of breastfeeding to help. Its main function really is to advise the Committee on Obstetrical Practice, of which it's really a subsection of. So not only helping to develop and check the accuracy, et cetera, of what the Committee on Obstetrical Practice produces, but also to act as a resource for other ACOG committees that from time to time might have something in their committee opinions or other documents that touch upon breastfeeding. So the work group will be kind of a resource to be used internally in particular, but also to be used externally to help develop patient information pamphlets and other outreach types of documents, and also to work with ACOG's PAC and the advocacy division so that we can again it's always critical to have good, accurate information that we bring to the Capitol Hill to get legislation passed. So again, I know we work closely with AAP on a lot of issues, but certainly these are issues that we are in the same pew. Future ACOG breastfeeding activities. I think I have to say even though when I was at the peak of my obstetrical career and losing a lot of sleep and all that, We encourage breastfeeding. My practice at that point was small. We only had 3 or 4 doctors, but we had Lamaze teachers in class. We called it Lamaze back then. I don't know if they still do that now, but birthing classes that we offered for our patients. We encouraged breastfeeding. Our nurses in the office were not necessarily back then trained lactation consultants, but they were usually labor and delivery nurses that had a lot of experience teaching kids how to latch on and that kind of thing. So basically, we always offered those kind of services. But I think even then, we didn't appreciate 10, 15 years ago even some of the documentation that's out there now, some of the evidence that's out there now about the value of this. And I think so that ACOG more so going forward, I think is really gearing up to do a lot more to, again, like I said, not only the committee opinions, but a lot more pushing of our providers to do this. The good news is, like everything else, as the younger folks come up, at least certainly within the OBGYN world, we've rapidly shifted to predominantly female graduates from our residencies. So they are actually having the experience of not just going home to your wife who had the baby, but of having the babies and knowing what it's like to breastfeed, knowing how to do that at work and all that. So it's made everybody, I think, a lot more sensitized to it, a lot more encouraging of it, a lot more, on the same page. So and a lot more understanding, and also helps to, I think it gives them more credibility when they say to patients, you can do this, as opposed to me telling my wife did it, so you can do it, So in that sense, we see some real benefits there. The ACM is our annual clinical meeting. We just had our last one about 3 weeks ago in Chicago, and we hold it every year, of course, being annual. So at the last meeting, we had a breastfeeding course as one of the offerings, and it was very well attended, got good reviews. So we've already decided we will continue to have that as an offering every year for the foreseeable future, but it has to go beyond the annual meeting. I think less than 10% of all of our 55,000 members go to the actual annual meeting, so we need to cut that up, parcel it out, and get it out to the districts and the sections in other ways, so that, again, this could be go out there also. And again, we're going to continue to collaborate with other organizations to especially again here in DC, to get legislation passed that is baby-friendly, mother-friendly. It's interesting. I think if we do the best we can for our patients, we'll help ourselves too. So it's not about going there to get more money or anything else. It's about really doing what's right quality-wise for our patients. So in summary, ACOG strongly supports breastfeeding. We recognize the value, and again, we heard some real good scientific evidence of the value for patients and infants. And we have multiple resources for our providers and our patients, and I think it's an area that we'll be focusing on even more going forward, and we will be even developing further. And we will also continue to collaborate to advocate for our patients, both in the community and in the workforce. So I thank you very much, and I hope to take any questions later. Thank you.